failings. This is a very personal video in collaboration with my lovely boyfriend JS, or as I know him, Ethan, which I probably will be calling him. Today's topic is a very personal one about a certain condition I have called Pcos, and Ethan here is going to help me talk through it because it can become a very emotional subject for me.
So we will be having to share the mic because poverty. And we will be doing this as more of a interview-esque thing, as we saw that there are a lot of questions going around on Google, and we wrote down the ones that we think are most prevalent, and we'll be going through them back and forth like an interview.
Yeah.
Without further ado, we'll start with the first few questions. That's right, I'm even going fancy with my cards.
Very professional.
So question 1, PCOS. What is it and what does it stand for?
PCOS is a symptom called polycystic ovary syndrome, and it very much gets its name that you develop small sacs of fluid that become cysts on your ovaries. It is a condition that deals with most and foremost hormone imbalance, infertility, and irregulation with periods, to keep it nice and simple.
Okay. How well do you feel supported by your medical system? And bear in mind, for people who aren't aware, she comes from Sweden. So we're talking about the Swedish medical system here.
I feel like from what I've researched online and heard from other people, my procedures aren't much different from how other people go by. It is just a lack of research and knowledge around this diagnosis that doesn't help me a whole lot, and makes my doctors not be able to give me any really significant treatments. You usually just get birth control to make you have regular periods, and in cases where it's in my case where I have a higher insulin because of my PCOS, I get also metformin to work against diabetes. Since metformin is an anti-diabetic medication. I know a lot of people get Ozempic for their treatments, but that's really the only things your doctor will prescribe you or help you with, unfortunately, which isn't very fulfilling to someone who suffers with this condition.
And just as a side note, the diabetes medication is not because she is diabetic. It is because PCOS is also referred to as
diabetes of the ovaries, and it's metformin is used to control your symptoms before it develops into diabetes, which it usually happens way later in life when you're way older.
Yep. So on to the next question. What age do symptoms typically begin, and what are those symptoms?
Most people will recognize symptoms around puberty. I very much did, which has a lot to do with what those symptoms are, because a lot of them are very physical. So I noticed male pattern hair growth, which I can grow quite the beard if I wanted to, at least somewhat. Not as nice as his, but it's not far away. And I also noticed irregular periods, that I didn't get my periods for half a year up to a year. You can also develop a lot of cystic acne, which is not fun during puberty. And you will have typically a big symptom is that you will have issues with weight gain and a very huge difficulty losing weight. which is another thing doctors will say to you if you have PCOS, is to lose weight, which is not very helpful because the condition itself makes it difficult to lose weight and easy to gain weight.
Now, for a slight curveball, why do you feel the need to make this video, especially since it is the first one on your channel?
I feel like, first of all, I feel like PCOS is a very under talked and discussed symptom when a lot of people suffer with it. I want to be a very positive outlook there, and for people who suffer with it, and knowing that we are not alone and we can help each other out. I also feel like it's a useful information about myself for the channel because, as I will discuss later on, PCOS also have some mental symptoms to it that affect a lot of people.
Back on track with questions you were actually expecting. What is the cause of PCOS?
The cause of PCOS is not known. Again, the research is so poor that we have so little information about it. Some people speculate that it's hereditary. There's a study that may prove that it's caused by a lot of childhood trauma and is your stress levels exacerbate to such a degree that you develop these symptoms, but nothing known, and there's no cure for it that we know of.
So to me, it sounds very similar to how you can develop mouth ulcers when you are under a lot of stress and anxiety as well. Would you agree with that point?
Yeah, I think that's a very good another symptom that's very affected by anxiety that can show in physical traits as well.
Yeah.
It's like when you get a heart attack symptoms from just a lot of stress and anxiety and panic. Yeah.
What are the treatments, and is there a cure?
The treatments right now are doctors will only prescribe you birth control and metformin or Ozempic. Out online, you'll hear a lot of people talking about billions of supplements out there for you to try that are somewhat proven to maybe work. A lot of people say omega-3 is good for weight loss. Spearmint is supposed to be good against hair growth, but it's a wild jungle to try and make sense of. And people will say diets that work for you and won't work, and yeah, it's not an easy landscape.
Now, this next question, I'll also want you to get a little bit personal and bring it back to yourself a bit. What are the social aspects of PCOS?
It's one of my personal harsher issues with my symptom is navigating this world when you have at sometimes a very debilitating condition that people will not take seriously. People mainly just think it's a hormone thing, you can't get pregnant, you may weigh some more, and that's the end of it. A lot of things is, first of all, self-esteem is a huge issue for people with PCOS. I know I have suffered very greatly with it. Things like another symptom can be male pattern baldness and hair loss, because again, testosterone, which feels terrible. The facial hair, that's in my case is very difficult to hide. The weight gain, and the chronic fatigue you can feel with PCOS, and just people assuming you're lazy, that you don't work on yourself when you're just in bed trying to get any energy to just make it worth getting up. And I've had many bad experiences with people around PCOS. Of course, since I developed my symptoms from a very early age, I got a lot of bullying in school, a lot of names that was called, and a lot of exclusion from people. Um, it's also been quite difficult with certain partners in the past who have very much left me because of my physical attributes, and finding belief that you are worth being loved and taken care of and being listened to can be one of the hardest things to struggle with, because yeah, we are worth more than our symptoms.
That ties in quite nicely with the next question of what are the hardest aspects of PCOS?
Yes. One of the reasons I want to make this video is that a lot of issues I relate to with some other symptoms I have, or conditions I have, is that I am chronically fatigued all the time. I barely can get the energy to get out of bed and motivate myself to take care of myself and be there for other people, which can leave you feeling quite like a bad person um, for the people around you. Um, a lot of it's just knowing that there's no real help for you out there, that you sort of have to like just try and research your way through getting any help. The only reason, or when you make progress throughout very dangerous methods, which I don't recommend. The only reason I could lose a lot of weight at one point was through a very destructive self-eating eating disorder. And just knowing that people won't take you seriously going through all these things, that you feel so alone and very desperate out there.
How common is PCOS, and is it the same for everyone?
Okay. PCOS is a way more common condition than people realize. About 8 to 13% of women have been diagnosed with it, and it's estimated that about 70% of women worldwide do not have a diagnosis yet. And it very much does not look the same in everyone. A lot of people suffer more with the insulin resistance. Other people may also suffer with the hair growth or the fatigue, the hormonal imbalance, which can bring out a lot of mood changes. So yeah, it's very, very dependent on yourself, and a lot of people out there struggle with it.
To end more on a positive note, what is your advice for women who may be going through this?
So I first of all just want to say that to all the women out there, this does not define you. You're as much of a woman as any other woman out there. You do not. You deserve to feel loved and acceptance and understanding from people around you, and you're allowed to be exactly who you are. Dress how you want. Be expressive in whatever way you can. And if you feel like you can't make it out of bed and you struggle with the weight and diets and don't get any more advice than to lose weight, then that doesn't mean much, because you're trying your hardest out there to just live with this, and that is more than well, I think. And you very much, when you open up and accept yourself, can find people out there who very much care and accept you and will listen to you. Which is why I have a last question back to you. I want to know, because we met and started dating 5 years ago, I think now.
Yeah, about 5 years.
About 5 years, and you had never heard of this condition before you met me. And what was your thoughts when you first met me, and thoughts you've had since meeting me that have come across that may be a bit unfortunate and stuff?
So, as mentioned, I was unaware of PCOS before actually meeting my partner. And some of you may be shocked to hear that, but as a guy, PCOS has never been brought up to me. So when we first met, it was quite unfortunate because you didn't have anyone around who could teach you how to shave.
Yeah.
And one of the unfortunate symptoms that she has is particularly hair growth on the beard. So immediate shock of seeing that the person I had been talking to was talking to me with a decent beard.
Yeah, quite
And
impressive, maybe.
it did cause me to have doubts, but I was out here for, I think, a week at the very beginning.
Yeah.
And so I decided, put those doubts aside for the week, just spend it enjoying your time. You'll see what happens afterwards. And almost quickly, I realized that it wasn't you. You were you. You weren't this condition that you had.
Yeah.
And this was exemplified by me actually teaching you how to shave.
That was a very interesting evening, yeah.
Yeah, because I remember how closed off you were about the condition. So for you to make a video helping others with the condition is very inspiring.
Yeah, I've walked through most of my life with a lot of shame around it, and opening up myself to you was scary, but so rewarding.
And I'm very glad that I didn't let your condition blind me to you as a person, because then I would have missed out a lot. But if that's all the questions, okay. Now, something that I didn't discuss with her earlier is that below this video, we're going to put a few articles linked in for advice on PCOS, on, day-to-day advice, conditions, symptoms. And of course, if you believe you have it, we urge you to seek out with a doctor and get support through your medical system. It will be different from America to England to Sweden. But the best thing is that there are medications that can help with some of the conditions. And we urge you to see a professional in order to start your treatment.
Yes. And I'm very grateful for everyone who has listened, and hopefully this has helped some people. And I hope to bring forth just a lot of enjoyment and good times in the future for my viewers. And for the last thing, I guess for you to say where people can find you, what you do, and so I just introduce yourself.
So I'll start with this channel is not going to be simply PCOS talk. This is going to be a one and done video unless there's a lot of comments who are people who are wanting more information. This channel will mainly be focused on Theodore's artwork. However, linked below will be a link to my channel where I am doing a variety of different things, but primarily to do with writing, with OC reviews, OC prompts, and we even host contests. So if that is interesting to you, the link to my channel will be down below.
Thank you very much for helping me out with this video and just being a huge support to me. And yes, I'll see you in another video. Thank you.